Hi, and welcome to this installment of Frank and Mary here in Northborough. If you haven't seen this show before, my name is Art Bergeron. My day job is as an elder law attorney at Myrick O'Connell, far away in Westborough. But this is not about elder law. This is about my friends Frank and Mary. If you've seen my presentations at the library or online, you know that Frank and Mary's goal in life is to live in their house until they die and be buried in the backyard. And if that's Northborough, that means right here. They don't want to go to Marlborough where I live. They don't want to go to Seattle where their kids are. They want to be right here. So the point of the show is to let you know the people you need to know and the programs you need to know about in order to stay right here for the rest of your life. So with me is Liz Tridiak, who has been your new, but you've probably still never seen her in person, Council on Aging Director, who showed up, I think, the month of COVID. It was like April or March, right? It was like right at the beginning. April, and she was just talking about fantasizing about meeting you all and giving you a hug. She was like, I can't believe I got all these seniors I've talked to. I've never been able to actually hug one, right? So she's getting close. She's got a great guest. This person who has become like a veteran here in Northborough. I think we first had her on 4 months ago when she was starting, not that long ago, right?
I think so.
So who do we have? And we're talking about an exciting topic that it's on everybody's lips. What are we talking about today?
Well, first, this is Kristen Black. She's our fabulous new Board of Health agent here in Northborough. She came on in the fall, and she's just been so phenomenal. Kristen, I can't give you enough credit. You came on board and you were in front of the Board of Selectmen. You were doing presentations, giving us new information, updating all the website. You've just been doing such an incredible job. We're so lucky to have you here. That being said, I was fantasizing about having this huge welcome back celebration here at the Senior Center with a band and music and food and catering and hugs, and you said no hugs yet. So we're kind of still in this holding pattern, but the vaccines are here. There's some that have been rolling out already. So I was just hoping that you could tell us a little bit about what's going on here in Northborough with COVID and what's been your main focus lately.
Great. Hi, Liz and Arthur. Thanks so much for welcoming me back. I officially started, it was October. So I guess, was that 4 months? It's flying. And we are really in the thick of things right now with vaccine planning. And so the great news today, our fabulous fire chief, Parente, received his vaccine. And so our first responders were all part of that program. And so they're really high up on the list, and they were part of a regional program hosted through Westborough. The towns of Southborough and a few others were involved. I think it was 4 to 5 towns. And so all of our first responders entered that. It's a Moderna vaccine they're receiving, and 28 days later, they'll be scheduling that second dose. Again, all with the great support and help of the town of Westborough and their fabulous health department and fire department. So big thanks there. Good news. I know we had great participation, over 80%, maybe well over 90% of our first responders took advantage of that opportunity.
That's and so.
Wow. Yeah, now we'll be moving through our list to say really who's next. You'll also be happy to know that the long-term care assisted living facilities in town, so Coleman Health, Beaumont, and Whitney Place, they also received their vaccine, or they'll be receiving it this week, the first dose and things like that. So that was all scheduled through CVS and a federal grant. It was federally distributed through CVS. And so the staff and residents in those locations have received the vaccine. So and now we're sort of moving on into our next tier. And I think for our seniors in town, really next on the tier of people you'll know and hear about, and we want you to help to spread the word, is anyone who's providing home-based care services. So if you have a visiting nurse or a personal care attendant who comes in, or even Meals on Wheels, delivery driver who would come into a home, all of those individuals are really next on that tier. So we are still at the phase 1 stage. And then beginning as early as February is the estimate for the state, will move on to phase 2. And that's where our seniors, anybody 75 or over, is right at the top of the list, or anybody with 2 or more comorbidities, Everyone says, what are those? It's a big long list on the CDC website. So we're quickly gearing up.
That's such great news. Yeah.
That is. So can you talk about kind of the logistics of it? Because once again, this is going to happen really fast. It's like February, and I wasn't even thinking about the logistics. But then I did this show. One of the other shows I do is in Nantucket, and they were explaining it, and I was like, oh my God, this is so complicated. Because when you think, so everybody over 75, that's a lot of people. So how do you find those people? How do they, where do they go? Who gets in line? Who sets up the line? How does that actually play out? And where do you go? In Nantucket, it's simple because everybody goes to the same place. They're all going to the hospital, right? Because there's one hospital and there's it's a small population. So kind of how is that working?
So actually, as we speak, Liz and I were back and forth today. We did just create an online notification form, and Liz can share that. We'll try to put the link up. It's on the town's COVID webpage under news and announcements. So it's a simple link where you can fill it out, your contact information, and you can check the boxes. Are you a healthcare worker, forward facing? Are you a healthcare worker, not necessarily working directly with COVID patients, but maybe you're a physical therapist working in office, or maybe you're providing home-based care. So we have a checkoff list on that form, and we want to encourage all residents to sign up because it is moving very quickly, and we'll be using that as our notification distribution list. I just spoke to Liz again today. We're likely going to try to produce a mailer, as well as using other outreach tools like phone, email, text, etc. The usual communication methods you'd see from your senior center to let people know when the vaccine's available, for each particular category. So we are hearing about some statewide vaccination sites. I think you've heard of Gillette, Fenway. I think I heard the Big E in Springfield Tops Fairgrounds.
Wow.
They will be opening mass vaccination centers. So we're going to see it at that high level, large centers run directly through the state. And then you're going to see some smaller clinics as well that are going to be stood up at local, fire departments, et cetera. We're in the process right now of applying with the state to try to be a local center. And we're that's mostly been my work this week, is trying to make sure we have all the approvals and forms. But there's also a possibility we may partner again with a neighboring community or communities to really just stand up a vaccine clinic that would run through phase 3. So we don't have all the details. There's going to be multiple, I think the take home, there's going to be multiple places to go. It's not going to be everybody in Northborough has to go to this one spot. We may even be learning that your doctor's office would be administering it, or CVS's, and so I think eventually we may get to sort of that flu vaccine model where there's a lot of different places to go. And so the information's not coming out, as quick as we all want, but like you said, Arthur, I think it's gonna come real fast. So pay attention. If you could fill out that online notification form, and then we're happy to inform you and let you know as soon as that vaccine is available, what documentation you would need to provide, if you need to have your insurance card or fill out a form in advance. And those are all the details we'll be working with and supporting residents through that process.
I see. But I'm sorry, Liz, go ahead.
Sorry, Arthur. I was just going to jump on and say that if you are a resident and you're calling, we here at the Senior Center can help you fill out that form. So if you don't have internet access or you don't have an email, just call us here at the Senior Center. We'll fill out the form for you to make sure you're notified when you're eligible for the vaccine. And the calls, today is the 12th of January, and the calls this week have been coming in fast and furious saying, why don't you just do it there at the Senior Center? And that's a great plan, but it's not just as simple as raising your hand saying, okay, I'm ready to set up a site here, ship the doses out.
You got some big refrigerators,
Yeah, we were actually talking about refrigerators and freezers earlier. Where would we get the freezer? Could we check the temperature every hour? It's the logistics of it aren't as simple as just saying you want it. It's a process.
So for Northborough residents, then you're going to be notifying them of the places where they may be able to get the vaccine. But then in terms of their setting up with those places, and kind of figuring out where they're going to be on the list there. Because I'm assuming in each of these places, there's going to be a list. There's going to be 15 minutes per person or whatever in order to be able to do this. Because I'm assuming people aren't going to be outside waiting in line in these places, right? I'm just trying to imagine that's going to be really intense. That's going to be really.
Yeah, the way it worked with the Westboro Clinic for our first responders is probably a model that we'll move forward with. Is the state is using a new program called Prep Mod. It's sort of like registering for any appointment. If you're registering for a massage or whatever, where you'd enter your information and then you pick a time slot. And so we'll likely be scheduling, using that type of system. So expect appointments, right? Because we want to maintain social distancing. We want to guarantee your spot. We don't want to put a lot of people in line and crowds waiting all day to get turned away. So most of these vaccine clinics or locations are likely going to be using that sign up model.
And Liz, how many, do you have an approximate number? How many people are over 75 or is it over 75 or 75 and over? So if you're 75,
75 and over.
75 and over. So you're in the first tranche. It was so funny. I was just talking, we were talking on another one of these shows, and I was like, it's so strange. The people are going to be doing fake IDs, to be showing, how old, oh no, I'm really 75. So it's 75 and older. So it's 70.
Yeah, there's 3,800 residents over the age of 60 in Northborough. Yeah. And I just requested from the town clerk the listing of that listing from the town census, so we can narrow it down to who might be eligible and figure out the very best way to reach these people directly, to let them know when they're eligible, where to go, and how to get vaccinated.
Because that would be and it's great that you've got, because it's Northborough, so you've got a pool of volunteers, you've got a great outreach person, and people dying to do something really, and this is really important, right? To actually be able to reach everybody.
Yeah, absolutely. Oh, Kristen, do you have any comments on the safety of vaccines? I know it's kind of coming up in the media, and people have asked us, this is an experimental vaccine, what does that mean? Do you have any comments on that for us?
Yeah, so I think it's important to note, typically the flu vaccine, things are a little simpler. The flu vaccine's FDA approved. The COVID vaccines at this point, because they went through the process, a little bit faster than we're used to, for sure, right? This was record development of a vaccine in a short amount of time. So they're operating under emergency use authorization. For that reason, there's a little bit more paperwork. But on the safety level, the techniques they're using, the way this vaccine was developed using the mRNA techniques, those were in the works for quite a while. So it's not like this was technology they first thought up on January 1st when they realized this was a problem in 2020, And so there's a lot of information out there on vaccine safety. If you go to mass.gov/vaccine, you can see there's some frequently asked questions, and there's some there about safety. Really, all of that safety data explanation of how the vaccines work, are they safe, is really housed through the Center for Disease Control, or the CDC's website. So that information's out there. They're transparent. There were, thousands and thousands of people involved in these studies. I personally, since we've rolled out in Massachusetts, haven't been hearing about these adverse reactions everybody's really worried about. And so it seems to be going really well. The information's out there on the CDC's website. And so we could provide those links or help you find them. And as always, I'd always recommend you contact your local primary care physician. Talk to them about your concerns. Everybody's, personal health care information is unique. It's different. And doctors are there to support you through that and understand your own risk and if this is appropriate for you.
That's a great point. And they can explain to you whether you have any comorbidities, right?
And
they're actually going to know, right?
Yeah, the comorbidity thing is very interesting. I was just working on that today. And again, right at the top of that phase 2, starting as early as February, is anybody 75 or over, or anybody with 2 or more comorbidities? That list is huge, right? Like you read, cancer and diabetes, and you're overweight and high blood pressure, and I said to Liz, I joked today, I said, I think I could check a couple boxes, so, have a look at that. There's nothing wrong with it. I mean, it's your health history. And, it means you're at higher risk. And there's a reason the state came out with this vaccine plan. So please don't, try to just push it off to the next person. Read that list. If you feel that you've met 2 or more of those categories, you qualify. And if you're not comfortable about that, call your doctor. Only your doctor could really help you understand if you met that list. And so please, please, please don't just say, oh, I didn't meet it, I don't have it. The list goes on and on. So I think a lot of people have said to me, I think phase 2 of this vaccination plan is going to be even bigger than phase 3 because so many people are going to fall into those categories. So it's nothing to be ashamed of. It's nothing, to say, no, but I'm young and I want to stand back. If you meet the requirement, there's a reason the plan was designed this way. We want everybody to be, as safe as possible. We want to get through this. So you're not helping the, healthcare system to not identify your comorbidities, not get the vaccine, right? Like we want to make sure we relieve our hospitals of the burden of patients. And so if you can get the vaccine sooner, less likely you would need to go to a hospital. So you're helping everybody. So please read that list. And that is linked on our state's webpage. If you fill out the form, the notification form we talked about, and again, it's www.tinyurl.com/Northborough with the GH at the end, vaccine. So again, /Northborough vaccine. And you can click right on those comorbidities and read the list for yourself and make that decision.
And I can see where this is going to, when you just said that, I said, ooh, I can see that's going to be what a lot of Liz's volunteers are doing, is trying to translate that to all the people who are my age and a little bit older who are like, what?
Yeah.
How is that again? Now, by the way, once again, so this is just trivia. So 2 comorbidities, that's if any age under 75, but with 2, it isn't like you're 65 and older and you've got 2 comorbidities. So it's anybody. Wow. So this could be a really huge phase. You're right.
Mm-hmm.
That's a lot, but it could also, in terms of cutting the death rate, it could really cut into that, right? That's great.
Yeah.
That's wonderful. That's wonderful. So can you just talk a few minutes about? I'm just curious if you don't mind my asking. How are things going? I know we're in this. The Biden keeps saying, we're in this dark night, but the dawn is coming. How dark is the night here? Is in terms of your numbers in Northborough, and how is all that working out?
Yeah, so numbers, obviously we're still in the surge, as you probably heard, the Baker-Polito administration extended some of those 25 occupancy restrictions. We're still limited at 10-person gatherings in homes or 25 outside, and that's both at personal residence and even, at some of those venues as well. So we're limited to gatherings, and that's because the numbers are still high. So we're averaging, let's say, 8 to 10 cases a day. I think in our most recent weekly case counts, we were in the 60, 70 mark. So we're not at that peak. Northborough was just I was blown away with the numbers in Northborough that week following Thanksgiving. That was over 93 cases in a single week, with the week ending on the Sunday. We're not back up to that. I'm hoping we're through our holiday surge. And the numbers are going to start coming down. But let's say we were at, even if we're at 60, 70 cases a week, back in the summer, we had 1 or 2. So, I mean, it's just much more prevalent, high viral load in comparison to where we've been. So, people need to be really vigilant right now. Think back to, what we did earlier on. If you can have your groceries delivered, like really reduce risk. There's certain things you can't avoid, the trip to the doctor's office, but, 5 trips back and forth to the grocery store and popping in to get that coffee and all those sort of things. This may not be the time to do that until things get a little better. And so, our case counts are high. They're coming down, but right now, those restrictions I talked about that were extended, that's all currently through January 24th. So we're still really trying to lock down, minimizing non-essential travel, et cetera.
But that said, don't miss your doctor's appointment.
Right.
They're paying attention. They're there, and you don't die of something else. That'd be a sad obituary, died from avoiding COVID, What was the good of that, right? It's kind of
yeah, and the good news is I think doctors' offices are so good with their screenings now, right? We've learned a lot. They're screening, for procedures, et cetera. People are required to test beforehand. So we're in much better shape than we were in the spring and knowing how to really limit the spread. and to, more safely have appointments. So again, like you said, Arthur, yeah, don't delay care. But it's all those non-essential things that you can try to avoid, right? Or what we want to try to avoid, which is, gatherings with friends indoors, without masks. If you're used to your coffee hour and we all sit around the coffee table, that we shouldn't be doing that right now. Like the mixing of households indoors without masks is not recommended.
The guys at the Dunkin' Donuts shouldn't be at the Dunkin' Donuts right now. Unfortunately, it's a sad thing.
Use the drive-through.
Yeah, you can't be hanging around at the cafe at the senior center. You
No.
just
Not
can't.
yet.
Not quite yet. So when are you thinking, Liz? When are you thinking that based on all of this, when is your fondest dream for when you can have that first thing at the senior center, or kind of
Huge welcome back celebration.
Yeah.
Late summer,
Yeah.
fall. I'm watching Kristen's face to see the reaction.
But no, Kristen, what do you think? And because obviously, you're talking with all those other health junkies, right now, right? We're all kind of, everybody's doing this because, you feel it. You can just feel it. People it's like when you think of how many people are going to go on a trip in 2022, it's going to be the most astonishing thing around the world, right? So you must be talking about this. What are you thinking?
Yeah, I mean, I think what we're hearing at the national level, right, with the experts, we need to get to this herd immunity. And herd immunity is when you get, let's say, approximately 80% of the population vaccinated. So we're so lucky that the Pfizer-Moderna vaccine is as effective as it is against stopping the spread or stopping illness, with it's 95% effective. And that's great. But, we have this whole group of everybody 16 and under, all those kids running around. And they're not approved for the vaccine yet. The vaccine's only been tested on, and it's only approved for the older ages. So it's going to be a delay of getting through the tests and the trials for children. And so that's why this is going to take longer than we think. If we were approved for kids and we had the vaccine, we could get our whole community done in 3 weeks, right? And then, and then the second dose. I mean, but it's that limitation, and not the unfortunate thing is not everybody's going to want to take it right away, right? That's going to delay our recovery. It's important for people to get the vaccine as early as possible when you fall into your category, and realizing that, children are going to be a long way off until that's approved. So, they're hopeful sometime summer or something like that, we might be at that approval process. So we have some time to go, but that threshold is that 80% vaccination. And right now you can't even offer it to kids because it's not approved. So
Does Massachusetts have enough vaccines, Kristen?
The state's been trying to really ramp up the communication on vaccine. They made a whole vaccine dashboard, to tell you the truth. So if you go to like the mass.gov COVID, they do have a whole dashboard. I haven't even had time to dig into it yet, where they're trying to say how many are administered. I know setting up the first responder clinics, I think there were at least 85 statewide, so many like ours, regional, where towns came together. It was more work than we all anticipated, right? More approvals, the time. And I think it's just working all those kinks out of the system. Once the approvals are there and you have a system and you know how to collect the data, I mean, this will run like a flu clinic. It's just that first step, right? Most of these sites don't have the refrigeration, right? They're not used to having to log, like flu vaccine is much easier to hold. It has less requirements. And so while we have nurses who are trained, et cetera, there's that infrastructure. It's building up the infrastructure and the additional paperwork that's required. So, I can't speak to the amount. I think we all have this, underlying feeling more is out there. We just need to get it to us locally, right? Get it to the providers. I think that's coming. I think it will move quickly. It's just, it's setting up that process that's been taking time.
So I think one of the many silver linings to all of this, and I think there are a lot, right, is that at the end of the day, everybody's going to know you, Kristen, and everybody in every one of these towns is going to know that, health is, you can't be healthy unless there's public health, right? I can't be healthy if my neighbor's not healthy. And that there's a real role, I remember reading when this was starting off, and people were just bemoaning how public health had been so shrunk over the last decade, right? Because it's like, oh, public health, why do we need that? But now it's like everybody gets it, right?
Yeah.
And it'll be a wonderful thing if, as a result of all of this, I don't want to say if Kristen necessarily gets a raise in the next town meeting, although this would be a good year to ask for one, if you're thinking about it, taking a shot here, right? But I think it's just a really wonderful thing to think this is just a crucial piece of what the town does, and of what you can, and it just makes you feel better about living in a town that's really kind of got that down. So
Yeah.
it's really an amazing thing. So Kristen, I know that my job, and as Liz knows, is I provide comic relief and also be timekeeper. And I'm watching our clock and realizing that we're about done. So I was wondering if Liz got any final questions before we wrap up.
How do people contact you, Kristen, if they have questions?
Sure. No, and I just want to tell everyone, please call the health department. Liz, you probably find the most rewarding part of your job is actually talking to real people on the phone and helping them through. So, we field questions every day from businesses, or, if you go to a store and you saw something that you felt was unsafe and they weren't following COVID practices, you'd report that to the health department. If you found out, I was with my cousin, Susie, on Saturday, she just called me. She says she has COVID. What am I supposed to do? Who am I supposed to notify? Those are the questions we're here to help you answer. You're not alone. So the easiest way to get a hold of us, it's 508-393-5009. And if you can't remember that, call the senior center because they have our contact information. You may have them on speed dial and they'll help to put you in contact. So please don't hesitate. The rewarding part is making contact with all of our residents, and no questions too small. We have two great administrative assistants that support the health department, Katie and Angie, and they're great with residents, and we're happy to point you in the right direction.
Well, this was pretty great. Kristen, thanks a million. Liz, yet again, right? This is just a great timing. Just great, and to the extent that we can be, I think, and this gets to the core of what the show is supposed to be about. It's really kind of helping seniors figure out a lot of this stuff, even seniors that may be kind of technologically challenged, to be able to click on the TV and see Kristen and get this kind of information. So this is just really great. Thanks a million, Kristen. Thank you, Liz, once again for doing this. Folks, I hope you found this useful. Once again, just the best, stay safe, pay attention. Get on that list, get your vaccine. It's almost over. And you get to give Liz Tridiak a hug at the end of the day. Thank you all for watching. We'll look forward to seeing you on the next installment of Frank and Mary here in Northborough. Thank you very much.